Hi, let's talk about the purpose or the purposes of ICD-10CM. Why medical billing at all? Why is it really necessary? You can just take the physician's notes. When the physician jots down the patient has a broken leg, we put a cast on it, bing, bang, bomb, it's done. Why does it have to be so complicated? Well, first of all, an ICD-10CM code is a 7 character alphanumeric code. And each one of those characters has a specific meaning. So the code would not only report that the patient had a fractured leg, it would report which leg had been injured, which bone within the leg was injured, which part of the bone in the leg was injured. In addition, it will tell us what type of fracture it is. Did you know that there are lots of different types of fractures? And the type of fracture, each type of fracture, has a different treatment plan. So, this is important to know for continuity of care, as well as assuring that the medical necessity, which is what ICD 10 CM codes explain, made the procedures, services, and treatments provided to this patient during this encounter appropriate. So, most people are familiar with ICD 10 CM with regard to claim forms and reimbursement. And yes, this is true that the ICD 10 CM codes, as appropriate, as documented by the physician in her words, are placed onto a claim form to explain the medical necessity for the procedure, services, and treatments provided to the patient during this encounter. So the third party payer, the insurance company or Medicare or Medicaid or TRICARE or whoever it might be, will see that the healthcare professionals that cared for this patient did so in a proper way, and they're there to help the patient and therefore should be reimbursed. In other words, paid. Money, 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 money. Okay. But that could easily be accomplished by setting the physician's notes, right? Except describing the fracture could take pages and pages. Whereas when we interpret it into that one 7 character alphanumeric code, computers can easily crunch it and say, yes, that matches this. Okay, send the money. In addition, computers can crunch these numbers and also identify new trends. Now, of course, we're not talking about trends as in the latest fashion. We're talking about trends with newly identified injuries and illnesses that may need the attention of researchers to find the cause and the cure, and maybe prevention, even better, right? It also can establish new care techniques. For example, a long time ago, certainly at least 20 years ago, um, the ICD codes, the diagnosis codes, were evaluated, and that helped establish factual evidence that those women who receive prenatal care before giving birth not only cost less for follow up healthcare services, but the children's health was better and resulted in less costly services. Now, I know we shouldn't be talking about money at a time like this. However, I'm sure you're familiar with the fact that some people are only swayed by hard and fast dollars and cents. And what happened was these researchers then took this research and showed the legislature that the cost of prenatal care, particularly for women on Medicaid, actually saved money in the long run. And once this research, these statistics were shown to the legislature, they voted to expand the services included under Medicaid so that these services would be paid for so women could get these services for their own better health and the health and well-being of their child, again, not only in utero but throughout the child's lifetime. So we see that diagnosis codes are very important when it comes to reimbursement. It's also very important when it comes to research, and it's also very important when it comes to legislative manners in which we can ensure better health and well-being for our population. I hope this helps you understand a little better. So have a great day.